Hi, I'm Dr. Mike Mossop here for COVID. Today I want to show you a little trick that will allow you to generate records more efficiently, especially in complicated cases. And what the trick is basically the ability to use the output from one template as an input for another template, all within the same case. And this concept of inputs and outputs, I think, is really important. So if we look at this case, you can see that I've started with two inputs, basically things I've added. And the most typical way to add something is an audio recording, but you can, of course, also use PDF or medical history files as an input. And if you go under this upload area, you can see that there's a few other options here as well. But in this case, we've got two inputs, these medical files, and then I've selected a medical history template and I've summarized those files, and the resulting output is this summary. And if you look at the summary, basically patient doesn't have any like deadly diseases, but they've got a history of skin stuff, otitis externa, some various GI issues, history of a vaccine reaction, some handling issues, that kind of stuff. And if we now go back, you'll see that when we created another input, so this is now the client walking into the room, I've recorded the discussion with them, it's about something totally different. So this one is about bladder stones. Basically, the patient has been having a little bit of hematuria for a couple of days. We did a urinalysis, we did some x-rays, we confirmed that there are bladder stones present. And now I'm ready to generate my SOAP. And the question is, how do I get all of the information from my recording in the room today into a document along with some of this historical information? And some of it might have been mentioned in the discussion, but other parts of it might not have been, but it's still important to a complete history. And so what you want to do in this case is you want to go generate from library, and you want to use this content area. And when you go here, this is really important. You're basically saying, okay, I'm getting ready to generate a record. I am going to use this audio recording, and I'm going to use this summary, which is down in my outputs area, as the material that is going to go into this generation. And we'll talk in a second about why I'm using this and not the original PDF documents. But basically, I've selected my input. I've selected an output to use as an input. I'm going to go back. I'm going to click my SOAP, and I'm going to click generate. And it should come in there. You can get creative. You can use any kind of combination here, but in essence, the reason I am using this output to contribute to the SOAP as opposed to the original medical history files is that this is a lot more focused. And it also, the system perceives it as definitively being historical information. So I think the line you're going to get between what happened today and what happened in the history is going to be a lot cleaner when you use this technique, as opposed to simply generating and using basically the recording and those original PDFs. Keep in mind, there's a lot of information to parse through in the PDF. So kind of summarizing it first is a nice way to kind of clean it up and make sure it's ready to contribute to your SOAP or whatever document you're generating. And when you look at the document here, you can see that the main presenting concern here is all about what we talked about in the consultation, that 2-day history of blood in the urine. But a lot of the historical information is coming from those PDF documents, and it's in a very kind of clean, reliable way. Again, in the physical exam here, most of this stuff was verbalized in the transcript, but things like the history of being very stressed at the vet is something that's coming from the historical record, and I think it's represented well here. So there you go. Same thing in the assessment. Again, stuff like urolithiasis, that's from today, but it's also calling out some of those historical problems. So yeah, this is just one example of how to use this. Again, I'd encourage you to get creative. And if you have any questions, just send us a note, support@co.vet. Thanks very much.